My name is Joyce Welch, and I am a clinical assistant professor at IU School of Nursing. My teaching assignment includes teaching pediatric clinical in a large Midwestern children's hospital. My clinical groups include 5 6-semester students having pediatric clinical twice a week for 3 weeks. My colleague, Teresa Korn, who is a clinical faculty at IU School of Nursing and continues to work as a staff nurse at Riley Hospital for Children, has worked with me in developing and initiating this project. A few years ago, I was sharing with Teresa my concerns about my past clinical groups and whether or not they were developing the skills and safe practice habits I was trying to instill. Frequently, students are fearful of pediatric patients, especially in a facility with many acutely and chronically ill children. But my recent students seem to lack a basic understanding of how to get started and proceed with their clinical assignment. Each student needed individual help and explanations when initiating and providing basic care activities. Presenting unit standards and discussing the unit's daily routine and orientation did not adequately prepare the students for getting started and accomplishing what they needed to know to begin a 3-week clinical experience. I felt I could do a better job giving students information in a way that could improve their clinical education and allow them to take more initiative in the learning process. During this time, many changes were also happening in the clinical side, including changes in documentation, practice policies, and procedures. As a clinical instructor, how do I keep up with these changes, keep the students informed, and help the students continue to gain clinical knowledge and skills? A clinical tool was needed that could be a resource for students and give them directions for getting started on the unit. If the tool could be used daily, it should help the students begin to develop basic safe patient care habits that could also carry over to other clinical experiences. Teresa and I began working to develop a tool that would meet our needs. A daily log that students could quickly check off activities as they were completed. Initially, the daily log was developed by compiling a list of minimum expectations for a new graduate nurse working in this clinical setting. By reviewing the daily log, the student could begin to develop a routine of providing safe patient care and know what the basic expectations were. The instructor would be available for assistance and supervision, but the student could be more self-directed in providing care. The daily log was developed further by reviewing National Patient Safety Goals and QSEN competencies and KSAs. National Patient Safety Goals were included and currently are highlighted so students recognize their significance. Several activities in the daily log stem from the skills statements identified for the QSEN competencies. As I present the different sections of the log to students, they begin to recognize the skills they need to develop and demonstrate during this clinical experience. The process for developing the daily log has been ongoing with changes made each semester as changes occur in the clinical setting. All changes are consistent with clinical course objectives and hospital policies. The developed daily log is 4 pages long and divided into 8 sections. While a shorter tool was initially desired, we did not want to delete important information and decided to keep 4 pages. The log is a checklist, short answer format. Each section will be discussed along with examples of what is included in that section. A copy of the current daily log is found under the Resources tab. The first section of the daily log is Safe Environment Initial Care, which focuses on what students need to do prior to beginning patient care and what safety checks should be done as part of the patient's initial assessment. As an example of what is included, students are expected to read the patient's entire chart summary report, which they receive at the beginning of the shift. This report informs the student of the patient's current orders, but frequently the students would quickly review the report and not comprehend what was included. When asked questions in pre-conference, such as, what IV fluid does the patient have hanging? What are the feeding orders? The student would state she did not know and question where she would find this information. Students were either not reading or not comprehending this report. They need to learn the significance of the chart summary and the direction it gives for providing safe patient care. Also included are safe patient care standards such as washing hands, universal precautions, ID and allergy ban checks, the correct IV fluids infusing, and equipment safety checks in the patient's room. Throughout the checklist format, a few fill in the blanks are added just to keep the students from going down the column checking everything without completing the task. For example, the student needs to state where the ID band is on the patient and where the code sheet is posted in the room. Developing safe practice habits is the focus in all sections of the daily log. Several of the activities stated help educate students on the skills stated in the QSEN competency on safety. Students are learning how standardized practices, such as daily safety checks and universal precautions, support safety and quality. Students also see how the visual reminders of what activities need to be done each day are helpful in remembering to complete specific tasks. Staff nurses have visual reminders to help organize their day and assure they are completing necessary patient care activities. This second section focuses on documentation, which is specific for the facility. Listed are assessments and nursing actions the students are responsible for documenting. Along with the activity, time frames for documentation are given. As an example, the frequency of assessing the patient's pain is stated under pain documentation. A pain score is documented every 8 hours as a minimum with initial assessment, every 4 hours for the first 24 hours following surgery, every 2 hours for a patient with a PCA, and every hour after pain intervention. The student has access to this information about our current policy on pain documentation and can follow the policy in providing patient care. Providing information on documentation saves the clinical instructor from having to review with students documentation guidelines. Initially, the instructor may need to remind the students that this information is on the daily log, but after saying this a couple times, students refer to the log for direction and documentation. Students accompany their patients to procedures off the clinical unit and need to check that their patient has a safe handoff form on the chart. This is also checked by the RN or clinical instructor. However, by including this on the log, the student also learns that this must take place and feels part of the responsibility for assuring the task is completed. The medication section consists of safe patient care tasks involved in giving pediatric patients medications. Activities included not only remind the students of what needs to be done, but serves as a resource for the specifics of practice. As hospital standards for central line care changed, these changes were incorporated in the log. Students learn that clean gloves are worn when accessing all central lines, and the policy for alcohol scrub is 15-second scrub, 15-second drying time with each line access. When initially presenting this information to students, students are informed that this is current best practice for children's hospitals at this time. This allows for a brief beginning discussion on evidence-based practice related to pediatrics. Central line activities are also starred so students recognize central line care as part of the national patient safety goals. Information requested on the intake and output and fluid balance section includes the basics of calculating daily maintenance fluid requirements and minimum output requirements. requirements. These calculations are taught in the Pediatric didactic class and in clinical orientation. Students use these calculations in determining if their patient has had adequate intake and output during their shift. Students then determine if any additional nursing actions are needed. Throughout the several semesters the daily log has been used, this is one of the sections students are most likely to leave incomplete, especially the first day. While these calculations are taught, students don't seem to make the connection that these formulas are actually used in practice. When questioning new students at the end of the shift, several of them are unaware of what the patient's intake has been, even though most of the pediatric patients are on accurate intake and output. Students are also unaware if their patient has had any output. Including this on the log reminds the students that this is important and part of the nurse's daily practice. After reviewing these calculations with the students and reminding them that this is a clinical expectation, students improve on their completion. At the end of the clinical rotation, several students have told me that completing this section of the log helped them understand the importance of I&O and fluid balance. For the first time, it actually made sense to them. While most students are motivated to interact with the pediatric patients and their families, needing to complete the short answers in this section gives students direction for communicating with patients and families. Recognizing the patient's developmental age and providing for developmental needs are part of the daily routine of a pediatric nurse, as well as providing support to families and involving them in their child's care. Developing and implementing a patient-family teaching plan is not a one-time activity to be met. Assessing the learning needs of the patient and family and meeting those needs through patient education and providing appropriate resources is part of the daily plan of care. Through completing the log and discussing patient-family developmental care and learning needs in post-conferences, students begin to see how these activities are important aspects of providing patient-family centered care. Information the students include in the log, as well as information collected during a more in-depth family assessment, provides a good starting point for discussing patient-family centered care during post-conferences. Along with looking at the skills needed in providing care, discussions progress to include many aspects of the QSEN knowledge and attitudes related to patient-centered care. Students are encouraged to remain non-judgmental and objective in their view of the patient and family. Discussions are led to assist students in recognizing differences in the diverse populations seen in the hospital, and how these affect attitudes and behaviors related to health care, pain, and child-rearing practices. Students are expected to participate in clinical rounds. With disease-based units in this hospital setting, clinical rounds are at a specific time and students are to be present when their patient is discussed. Students are assured that the healthcare team wants them present and values their input. Students are told that it is okay if they are asked a question and don't know the answer. They can state that they will ask the staff nurse or their instructor. The instructor assures them that questions are not asked to put them on the spot or intimidate them. They are asked questions because they are part of the team. As students become more comfortable, they are very satisfied when they are able to verbally contribute to clinical rounds. By participating in rounds, the students meet some of the skills of the QSEN competency on teamwork and collaboration. Students begin to see the differing roles of the various healthcare team members and how these services work together in providing care for a sick child. They observe how the team communicates with each other. Through conversations with the clinical instructor, the student is given a role in the process. Students are encouraged to let the patient, if age appropriate, and family know when clinical rounds start each day and approximately when the team will be to their room. Students are also encouraged to have the family think about what questions they want to ask. If the parents are not comfortable asking questions or forget to ask, the student can ask the question for the parent. Students are encouraged to interact with all healthcare team members involved with their patient's care. While on the student's written care plan, nursing diagnoses are stated. This section has the student write 2 specific goals for their patient for that day. Students are to discuss with their patient's nurse the goals for the patient. Students also identify a goal for themselves. Ethical issues are stated at the end of this page. Usually students state things they have seen or heard on the unit which causes them concern. Items listed in this section frequently provide topics to be included in post-conference discussions. In reviewing students' comments, faculty are able to gain insight into student issues with decisions made regarding patient care. Once the daily log was developed, a pilot project involving 2 clinical groups was completed to trial use of the daily log. Students were oriented to use of the log with each section discussed in detail. The clinical instructor explained that the information on the log not only informed the student of the clinical expectations for care being provided, but served as a resource for providing that care as well. In reviewing the log, the instructor was not concerned that every section be fully completed each time, but that the student completed as many of the sections as possible. For the first couple days, there may be some incomplete areas. However, as the student progressed, the goal was that the student could complete all areas. One of the instructor's goals for the log was to assist the students in being more self-directed. If the instructor was busy with another student, students could refer to the log for what patient care activities needed to be accomplished. By completing safety checks and other log activities daily, students would begin to develop safe patient care habits that could be continued throughout other clinical experiences and into their nursing careers. The students' response to orientation of the log was positive. They were excited to begin, and most felt that by reviewing the daily log, they knew what the pediatric clinical expectations were. The pilot project went well, and after a couple of clinical days, the students were able to complete most, if not all, of the log activities. Student evaluations from the pilot project focused on the type of activities listed on this slide. Many comments focused on a variety of safety checks. Several students stated they finally understood INO and fluid balance. While these comments were from the pilot project, they are still the same types of comments heard from students in semesters following the pilot project. This past week, as another clinical group was completing their final day, students were asked to share feedback, both positive and constructive, about the various aspects of their pediatric clinical, one of these being the use of the log. Student statements included, "This was the first time I checked IV fluids and tubing expiration dates. I liked the section on INO because working through the questions, I could understand why this was important. The information on all the safety checks was good because I never knew we were supposed to do all of this. The log helped things not to be so overwhelming. You could think of things as a nurse does." For constructive feedback, one student stated she thought the developmental section was confusing to complete when working with infants. Several students felt it was difficult to write goals for themselves. This constructive feedback gives the instructor possible areas to include in future discussions with the students. Clinical instructors' comments included that students were able to perform basic care tasks more independently. Students were more self-directed. Instructors felt the students received consistent information related to safe practice and had increased satisfaction with the clinical experience. Students felt more a part of the team because they were more involved in care. By not having to frequently review basic care tasks, instructors had more time to work with students on more complex critical thinking skills. With the daily log incorporating several aspects of the student's written paperwork, reviewing student paperwork was less time-consuming for the clinical instructor. It was easy to review and identify student strengths and areas for improvement. With the positive evaluations from students and the clinical instructors following the pilot project, the daily log was incorporated into the pediatric clinical paperwork. Each semester, the daily log is reviewed and changes are made to assure consistency with clinical practice changes and pediatric clinical course objectives. Format changes are made at times to help make the log easier to read and complete. Faculty and student evaluations are done periodically to assure students are achieving the intended goals. Students would benefit from having a checklist each semester that included the basic safety checks at a minimum. Checking IV fluids, tubing expiration dates, ID and allergy bans, and safety equipment in the patient's room is not specific to pediatrics, but important in all clinical settings. While this daily log was developed specifically for a pediatric clinical, this format could be easily modified. Checklists could be made to include QSEN competencies, safety standards, and expectations for any clinical setting. Helping students develop safe patient care habits that continue into their nursing career is the goal of all clinical educators. In our pediatric setting, having the students complete the daily log has assisted them in developing these habits and allowed them to be more self-directed and independent in providing basic patient care.